Thank you all for joining me today. As I said Friday, staying at home has allowed us to not only reverse an exponential increase in our new case rate, we've cut that rate in half. And that bought us precious time to deal with the overwhelming challenge of COVID-19. When it comes to a crisis, preparedness is everything. And Pennsylvania has a great team working behind the scenes to coordinate our response. I've asked Randy Padfield, the director of the Pennsylvania Emergency Management Agency, to join us today to provide a little more detail on our response. But I want to reassure all Pennsylvanians that we are in good hands with the team at PEMA. This team, along with the Department of Health, has been monitoring the virus since January. Here at PEMA's headquarters, the Department of Health's Operations Center was established even before the virus was first detected in the United States. And PEMA's Commonwealth Response Coordination Center stood up full operations just a few weeks later, supplementing planning and coordination efforts with staff from dozens of state and federal agencies and partners. These partners include the American Red Cross, as well as other vital volunteer organizations. Across the Commonwealth, PEMA is working with the diverse emergency management agencies in each and every one of our counties to identify and eliminate potential issues by providing the necessary guidance and support to execute their local emergency plans. And PEMA is working hand in hand with the Pennsylvania National Guard on its missions, which vary from food distribution to nursing homes to establishing mass testing sites. One great example of PEMA's ability to facilitate problem solving is the rollout of the Battelle Critical Care Decontamination System. Like other states, Pennsylvania had initially hoped to increase our stockpile of personal protective equipment, but soon found that suppliers could not keep up with the demand of our medical professionals. When the Food and Drug Administration issued an emergency use authorization for the Battelle system, PEMA worked with the Federal Emergency Management Agency to bring a Battelle system to Pennsylvania. The Battelle system can decontaminate certain N95 masks up to 20 times, and the cost of the system is covered through the U.S. Department of Health and Human Services. The Battelle system is a great way to increase the availability of clean N95 masks, and I encourage organizations to take advantage of it. It's just one of many programs that PEMA has helped facilitate with little fanfare. PEMA is quietly effective. We know they're doing a good job when we don't hear much about them. And I can say that has been the case so far during this crisis. There's a lot to worry about during a pandemic, but Pennsylvanians have not had to worry that we'll miss out on federal disaster aid. They haven't had to worry about 911 centers becoming overwhelmed. And they haven't had to worry that other emergencies won't be taken care of during this pandemic. That's all because PEMA has efficiently and effectively done its job. So I'd like to thank the hardworking employees at PEMA for all they've done over the past 5 months, working a scenario that they've never faced before. The training and planning that they do year-round is tested during exercises, and all of that experience is being acted upon now. So thanks again to PEMA for all of the good work they do. Now I'm going to turn it over to Director Padfield, Randy Padfield, for more details on what his team has been doing. Randy?
Thank you, Governor Wolf, and good afternoon. As Governor Wolf indicated in his remarks, PEMA has been actively engaged in the response and support of the Department of Health to the COVID-19 crisis since February. While this crisis is significantly different than any that our agency is normally accustomed to dealing with, especially because of the complex nature and far-reaching effects, this has resulted in a number of impacts outside of the public health spectrum. These impacts require extensive planning and operational coordination across multiple agencies, organizations, and levels of government to effectively address. As the Governor indicated, our Commonwealth Response Coordination Center here at PEMA has been activated since the beginning of March, prior to the first case of COVID-19 ever being reported in the state, in support of planning and response efforts in concert with and in support of the Department of Health. The center is staffed with agency representatives from various state agencies such as the National Guard, Pennsylvania State Police, Department of General Services, Department of Human Services, and Department of Community and Economic Development, as well as several other representatives from other state agencies as needed to be able to support operations as necessary. Since being activated, PEMA staff and staff from other supporting and assisting agencies have been working hand in hand with the Department of Health to assist with planning and support functions to effectively respond to this complex and challenging pandemic. The Commonwealth Response Coordination Center serves as the primary coordination center and structure for all agencies supporting the response and works collaboratively with the Department of Health Departmental Operations Center, which oversees the entire public health response. The Commonwealth Response Coordination Center is organized in accordance with the National Incident Management System, or NIMS guidelines, and predominantly serves to coordinate response and recovery operations across all levels of government, to include assistance from the federal government through the Federal Emergency Management Agency. The primary functions within the Commonwealth Response Coordination Center include maintaining situational awareness and providing a common operating picture across all levels of government every day throughout the Commonwealth. Conducting strategic and operational planning in support of response operations, coordinating resource support for state agencies and county governments in support of local jurisdictions during times of disaster, coordinating recovery operations across state, county, local governments, as well as private nonprofit organizations and other applicable entities. To give you some of the examples of the type of support that has been coordinated through the management structure in the Commonwealth Response Coordination Center, our agency has assisted with, as the governor indicated, the establishment of community-based testing sites early in this incident. Originally, Pennsylvania was not slated to have any federally supported community-based testing sites, but working with FEMA and taking a look at the statistics and the case counts in the Commonwealth, we were able to lobby to be able to get a number of community-based testing sites established in the state. This includes sites in Philadelphia and Montgomery County, and it includes continued support of a state-run site that is in Northeast in Luzerne County. We've also coordinated support across multiple agencies and counties for large-scale feeding operations. The impacts from COVID-19 and the crisis has been significant, especially with the amount of people that are out of work and the increased need on the food and food security. So our agency is coordinated across multiple agencies and counties and food banks to be able to assure that we have adequate personnel to be able to cover the increased feeding needs of the Pennsylvania citizens. We also acquired meals that were ready to eat or shelf-stable meals to be able to supplement some of the other feeding concerns, especially early on when we had a lack of nutritious food to be able to hand out at the food banks. We also coordinate in the early stages of the incident support through the Army Corps of Engineers for assessment of alternate care sites across the state that were potentially needed to handle the medical surge associated with COVID-19. We looked at a number of sites and facilities across the state in case we would realize a significant impact to serve as these sites and what it would take to be able to establish them and be able to staff them. We still maintain a number of sites across the state in a warm status just in case we would have an additional surge in the fall. We've also assisted in procuring additional materials and staffing through FEMA in support of the COVID-19 response. As the governor had indicated, the early acquiring of a Battelle system for the Commonwealth of Pennsylvania alleviated some of the needs on N95 face piece respirators for the medical care community. The last update we received, they have over 300 agreements signed for agencies across the state to be able to send their N95 masks to the Battelle system for decontamination to be able to be reused. We've also worked with the Federal Emergency Management Agency and Health and Human Services to be able to acquire medical personnel to be able to assist at the alternate care sites, most specifically the alternate care site in Philadelphia. But these medical personnel also assisted in a number of the impacted hospitals in Philadelphia and the greater Philadelphia healthcare system. And obviously, we coordinate on a regular basis with the National Guard to provide support to long-term care facilities, feeding missions, mortuary support services, especially in the Southeast, in some of the hardest hit areas during this crisis. The National Guard continues to be a great partner. They are there usually throughout any disaster with us, and we appreciate their support. These are just some of the examples of the support that's been coordinated through the agency. However, as I indicated previously, we can't do this alone. One of the critical components to the emergency management system in the Commonwealth, and as the Governor alluded to, is our city, county, and municipal emergency managers. They play a crucial role in providing operational coordination and assistance across county and local governments in support of the state efforts. While it would be extremely rare for a natural disaster to affect all counties simultaneously in the Commonwealth, this disaster or crisis is much different. All counties have been affected to some degree and have been actively engaged throughout the response thus far. Their tireless efforts in coordinating support at the county level are critical to having a safe, well-planned, and well-executed response. This crisis will undoubtedly be one of the longest, if not the longest, and most complex response and recovery operations that our agency has ever undertaken. It will require everyone across all response disciplines, levels of government, and agencies and organizations working together to address the complex problems that have resulted and will continue to result from this crisis. PEMA and the extremely dedicated individuals managing this response across the state remain committed to assisting and supporting the citizens of the Commonwealth during this crisis. Now, I'd like to turn it over to Colonel Montgomery from the National Guard, who, again, as I said, has been a great partner during this response, to speak in greater detail about some of the support they have provided during this crisis. Colonel Montgomery.
Thank you, Director Padfield. Again, I'm Colonel Frank Montgomery. I'm the Director of Military Support for the Commonwealth. I'd like to thank Governor Wolf and his administration for the opportunity to speak to you today regarding the Pennsylvania National Guard's response efforts in support of the Commonwealth for COVID-19. I'd like to thank Director Padfield, Deputy Director Sevenson at PEMA, Secretary Levine, and at the Department of Health and their respective staffs who've enabled the National Guard to rapidly respond to need and integrate with our agency partners in support of local governments across the Commonwealth. On behalf of the Adjutant General, the Pennsylvania National Guard, Major General Anthony Corelli, the National Guard has 1,200 service members dedicated to supporting the Commonwealth agencies in response to COVID-19. These soldiers and airmen come across the four corners of the state and have selflessly served for the past few months. Our forces are broken into three geographical task forces, North, South, and West, as well as functional task forces to include logistical support, force health protection, aviation, and medical operations. A summary of our missions that Director Padfield covered briefly state how the National Guard was involved. Started off with the repatriation of 21 passengers from the Grand Princess cruise ship, where we transported them from the Harrisburg airport to their homes. As the director mentioned, we established 2 community-based testing sites, and to date, we've tested over 12,000 citizens. We supported the Greater Pittsburgh Community Food Bank, packaging over 90,000 meals for families in need. We've transported various commodities across the Commonwealth to include PPE, medical equipment, and over 550,000 meal kits to numerous organizations. We assisted with setting up 2 alternate care sites. We also established a dual status commander led by Brigadier General Mark McCormick, who oversaw medical operations for both Pennsylvania Guardsmen as well as Title X Reserve Component forces assigned from Northern Command. Approximately 85 medical professionals who conducted missions in 7 Philadelphia area hospitals, as well as the alternate care site at Temple University. In collaboration with PEMA, the Department of Health, and the Hospital Association of Pennsylvania, we established a medical planning team that coordinated efforts with respect to long-term care facility support. They have developed an assessment protocol and visited 13 sites who requested assistance with staffing and training. Teams were built to include physicians, nurses, medics, and general purpose forces to provide staffing assistance, as well as any training in the use of PPE, don-doff procedures, or decontamination measures as needed. It's an honor for us to work alongside with long-term care staff to serve this vulnerable population. To date, we have provided over 3,500 days of staffing support to 10 long-term care facilities, and we are still currently supporting 5 such facilities. We are standing up a mobile testing capability where the National Guard will send teams into long-term care facilities identified by the Department of Health to assist with conducting tests for residents and staff. We provided assistance to the Philadelphia Medical Examiner's Office with the dignified transportation of decedents from area hospitals. We currently are and will continue to conduct screening operations for our own personnel, ensuring our own force health protection. We've conducted 31,000 such screenings to date, at many of our facilities as we transition back to our federal mission requirements. Our leadership, the Joint Operations Center, and the task force staffs have been working diligently to ensure the timely success of these operations, the safety and well-being of our service members. We've been coordinating with National Guard Bureau and many other states on their response efforts to ensure that we are implementing best practices. So, the bottom line is we live here, we train here, we serve here. We're proud to take care of our fellow citizens who are in need. And at this time, we'll take any questions.
Our first questions are for Governor Wolf. We have several questions from 6ABC about gyms. What are the penalties for gyms that reopen?
Well, when we talk about penalty, the real penalty is that the people risk getting sick. And I'm not sure how gyms are regulated at all, but if they depend on a license from the Department of State or Department of Community and Economic Development or the Department of Health, then that's where the responsibility lies. But the primary responsibility here lies with the business and the person making the decision there and the customer. And every time a customer goes to a gym, right, with this coronavirus, as contagious as it is, they risk getting sick.
Gym owners we spoke to say that they can follow fewer people in their gym and have health precautions in place, and it would be safer than the crowded workouts people are having outside right now. What is your response to that?
Yeah, again, we're looking at a situation where every time when you bring people together, when they touch things that others who have the disease have touched, they increase the risk that they're going to get the disease. We're trying to keep people safe, and every time people get together for whatever reason, they risk getting sick, and we want to keep that from happening.
And finally, from 6ABC, at the very least, to survive, gym owners say they need a timeline as to when they can reopen. Can the state provide that?
No. Again, we have a timeline that's being set not by the state, it's being set by the coronavirus. And we're looking at ways to defeat that virus. And that's what we're trying to do, taking advice from people who have done things like this before, from public health officials, from the federal government, from local governments, from the state. And all of this is in service of trying to keep people from getting sick.
Our next question is from ABC 27 for you, Governor. NASCAR is scheduled to race at Pocono at the end of June. On Friday, you said Pennsylvania is not ready to make a decision about that race. What criteria are you waiting for to make that decision? Would you allow NASCAR to race without fans if Monroe County is in the yellow phase?
Yeah, if Monroe County goes to yellow before that race happens, and NASCAR, in fact, has the competition without spectators in the stands, and they follow other guidelines to keep the competitors safe, yeah.
Both 6ABC and WNEP have a question about curbside retail. Curbside retail has opened up in New Jersey just over the bridge from the southeast region. But here it is not permitted in the red phase. Why? Small business owners see restaurants being able to do curbside pickups. Why can't retail?
Actually, retail is open now as of this coming Friday in 2/3 of the state, which are in the yellow phase, where curbside pickup is actually allowed. Again, we're trying to keep people safe. The more you congregate, the less you stay home, the greater the opportunity for that virus to spread. We want to keep people safe. I think we need to do everything we can to avoid contagion, avoid congregating.
We have another question from 6ABC. Lots of people were seen over the weekend at the beach in South Jersey, many without masks. Is there concern this region will see an uptick? Also, talk again, if you can, about how some activities can be low risk as long as you have a mask on.
Okay, let me see if I can remember those two questions. The first one is, if you go to the beach, and I wouldn't go to the beach, there are people there who aren't wearing masks, and you're putting yourself at risk. I wouldn't do that. I haven't done that. And I'm not sure why the governors of Maryland and New Jersey have opened their beaches, but they have. What was the second question?
That was if you can talk again about how some activities can be low risk as long as you have a mask on.
Well, again, the mask protects other people. When I wear a mask, I'm protecting you from getting anything that might come from myself. And when you wear a mask, you're protecting me and everybody else around you. So if you're not wearing a mask, then you're being fairly cavalier about protecting the people around you. And that includes people that you might care about very much. So I think in any setting where you're going to be close to people, you should wear a mask.
We have another question about gyms from Philadelphia Inquirer. A Bucks County gym reopened this weekend despite the Philadelphia region remaining in the red phase. What message do you have for the owners? And who is responsible for enforcing the business shutdown order? And how are they going to go about ensuring other businesses don't follow that gym's lead?
Yeah. Okay, first of all, I'm not sure about the formal enforcement, but nobody in any walk of life should want to put their customers in harm's way. And that's what opening a gym where you actually work close together, where you touch things that other people have touched, that's just not something that I would feel comfortable going to, a place I would feel comfortable going because I'd be worried about risking my health.
Thank you. We have some questions for Colonel Montgomery. From the Times-Tribune, can you identify each nursing home at which the National Guard has sent medical staff or has provided assessment services?
As I had mentioned, we provided assessment services at up to 13 facilities and provided staffing assistance at 10. Some have been reported in the media. I can indicate the counties that we've been in, but did not want to indicate necessarily each individual site. We're in Beaver, Delaware, Lackawanna, Dauphin, Franklin, Schuylkill, Chester, Pike, and Northampton counties. Those are the counties where the facilities reside that we either are currently in or have worked in.
Thank you. We have a couple of other questions for you, Colonel, from WTAE. Is there an update on the National Guard's response at Brighton Rehab in Beaver County? Do they think they'll need to extend their time there?
We coordinate end dates with PEMA and the Department of Health. We are currently working there. I believe in the very near term, though, we will be done. And the facilities indicated we're no longer needed. But it probably in the very near term, within a day or two.
Also from WTAE, one more question for you, sir. Are you hearing from any National Guard member who responded to Brighton Rehab in Beaver County, and how have they been affected?
In terms, I guess I don't quite understand the question, affected in terms of, I know they're very proud and happy to be there and be serving the Commonwealth and to assist very vulnerable residents. And so that's the only feedback I've received today.
Thank you. We have some questions for Director Padfield. From Fox 56, are you seeing improvements in nursing homes?
So that's a very difficult question to answer because it is such a dynamic response. So we see improvements in certain nursing homes, and there is a different level of intervention that occurs, and that is coordinated through the Department of Health. And that may start off as a telephone consult for an outbreak in that home and to provide additional guidance and explain their guidance to the nursing home. In certain circumstances, we've seen improvements in those situations with just that intervention. And in certain other circumstances, the outbreak continues to grow, and then that's when we usually get the National Guard involved. We're also working on coordinating federal support to be able to bring in outside entities to be able to actually provide support to the homes as needed. So we've seen improvements in some of the significant outbreaks where they have lesser numbers or they have the outbreak contained, but we also see that we have new facilities some days that have outbreaks. So it's kind of hard to generalize on that, but it goes back to the fact that this has been a very dynamic situation, and ultimately it takes the Department of Health and the other agencies supporting this response looking at the data every day to be able to make informed decisions on how to act.
We have another question for you from CBS 3. Families with loved ones in nursing homes are outraged at the lack of preparedness experienced in so many facilities in the Delaware Valley. They were complaining to us about conditions 2 months ago. What should the state have done better? What do you say to those families about their characterizations these nursing homes were death traps?
So that's a very difficult question, obviously. The challenge is that no two nursing homes or long-term care facilities are created equally. So trying to generalize against a number of them is very difficult. And we see that, especially Colonel Montgomery and the National Guard that have been involved in this process. They're all prepared to different degrees. Very similar to emergency management agencies. Different counties have different levels of preparedness based on what their risks happen to be. So that's, ultimately, we want to be able to assist, and we understand that not everybody can be prepared at every level, and that's what our agency is here for, and that's what actually the county agencies are there for as well. And we've seen them do some tremendous work where they've stepped in to be able to provide some bridges for personal protective equipment until Department of Health is able to ship additional personal protective equipment out. So it really takes everybody working together to be able to bring the resources to bear on these issues, because they're quite diverse and they vary from facility to facility.
Thank you. Our next questions are for Governor Wolf. From WTAE. This past weekend marked the first weekend most of southwestern Pennsylvania was in the yellow phase. Are you getting any information on how things went in that region?
Yeah, actually Friday was the announcements last week were official on Friday, but today was the first day. For example, Pittsburgh was in the yellow phase. And I talked to the county executive, and he said that actually a lot of people, not very many people were showing up, were coming into downtown Pittsburgh. And again, that gets back to when we get to enforcement issues. The ultimate enforcement is the confidence or lack of confidence that ordinary citizens in Pennsylvania feel, when they go to a place, a store, or back to work or to school. So we can do anything we want in terms of snapping our finger and saying we're going to go from red to yellow, from yellow to green. But ultimately, the decision makers are the people of Pennsylvania. And when they decide, as apparently they did this morning in Pittsburgh, that they're not going to show up, that's the reality that all of us have to deal with. They are actually trying to understand what that virus is going to do. They're trying to fight that virus, as we all should be. And that's what I think is a good object lesson, that some things are different now, that the Southwest is in a yellow phase, but so many things haven't changed because people still are looking to feel confident.
Our next question is for you, sir, from Capitol Wire. During your announcement last Friday about additional counties moving to the yellow phase, you seem to suggest that most Pennsylvanians don't understand the risks of COVID-19. And after 2 months of people self-distancing and for the most part putting their lives on hold, all to flatten the curve, we have succeeded in that. Excuse me. It's a long question. You appear to be telling people who are wondering why the flattening the curve goal wasn't enough, that they just aren't smart enough to understand the risks, of which they've been reminded every day, and can't be trusted to do the right thing. Was that the intention of your remarks on Friday?
Absolutely not. In fact, the ultimate arbiters of success or failure here are the individual people of Pennsylvania, every single one of us. Now, I guess there are a lot of people like me who haven't been trained in public health, and we can learn a lot from the experts at Department of Health, PEMA, and other places, but ultimately we have to each make our own decision, and we are the experts. And each and every Pennsylvanian making that decision has done really phenomenal things for Pennsylvania. I think Drexel University just said today that doing what Philadelphians have done so far in this crisis have saved 7,000 lives just in Philadelphia. And that's true all across the state. By doing what people have done, by staying home, by actually living this pandemic in a way that reduces the possibility that this virus will spread, that has saved lives. So, no, the idea was that there are things we can learn about how to deal with viruses like the coronavirus, but Pennsylvanians, I think, have learned that, and we have done a phenomenal job.
From the York Dispatch. U.S. Representative Scott Perry has called for a federal investigation into your administration, alleging it failed to adequately protect nursing home residents during the coronavirus pandemic. How do you respond to this? Do you think it is another example of politics getting in the way of the state's recovery efforts?
Well, I think that question probably ought to go directly to Representative Perry, but let me just point out that we have weekly calls with the congressional delegation where Secretary Levine and others give a briefing, an update as to what's happening with the pandemic here in Pennsylvania. And so that is an opportunity to make sure that we're sharing information. In terms of challenging the Commonwealth on anything we've done, that's the nature of a democracy, and I welcome those questions and criticisms.
And our last question we have time for today is for you, sir, from the Philadelphia Inquirer. As of now, do you foresee having to extend the Philadelphia region's stay-at-home order past June 4th? Or should businesses and residents there prepare as if it is when they will enter the yellow phase?
We haven't made a decision. Philadelphia they have their own health department, and we communicate daily, and I think we're all trying to do the same thing, which is keep people safe.
Thank you very much, Governor. Thank you, Director Padfield, Colonel Montgomery. That is all the time we have for today. Department of Health will have a briefing today at 2:15. Thank you.